Good evening, one and all. Welcome to the webinar session brought to you by Project Step 1 on Your Body, Your Mind. Ask these two doctors your questions, part 2. I'd like to welcome our speakers of the day, Dr. B.C. Rao, family physician and mentor, AFPI Karnataka. And we also have Dr. Ramakrishna Prasad, MD, MPH, founder and director, PCMH Resort Health, Vice President, PFI Karnataka. Welcome and thank you for joining us, Doctor. I am Supriya, your host and proud volunteer at Project Step 1. Project Step 1 is an 100% volunteer free service. We are 12-month-old initiative that provides free telemedicine to COVID-19 impacted citizens across 18 states in 18 languages. We have more than 50 million live through 2.3 million teleconsultation. This has been possible because of our community of citizen, volunteer, doctor, and of course our counselor. Dear doctors and citizen, your 1 hour per day can save thousands of lives. Project Step 1 is an impactful citizen and doctor driven initiative, and it needs to be spread wider to be able to get COVID under control in India. Dear doctor, watching this session, give a missed call to 08047192219 to join the largest doctor volunteer group. Citizen to volunteer, give a missed call to 08061972266. So about today's session, there are the medical questions or problems you have wanted to ask a doctor but haven't been able to. Well, we have created just the right opportunity for you. Dr. B.C. Rao and Dr. Ramakrishna Prasad, two highly experienced family physicians, are making themselves available to engage with you and answer your questions, to join the conversation and make use of the opportunity. So, over to you, Dr. Ramakrishna Prasad. You can take it.
Thank you, Supriya. Always a pleasure. We did this 3 weeks back, and it was quite enjoyable for us, and we received some good feedback as well. So excited to be back together. Um, um, Dr. Rao, just like last time, let's keep it conversational. We have a whole host of questions that people have asked us, and we'll take them one by one, discuss, share experiences, insights, and sometimes things that intrigue us with the audience. And should we get started?
Yeah.
Okay, great.
First of all, thank you, Supriya, for inviting us again, and all of you who are listening and watching us. I hope this session also will prove to be beneficial and fruitful to all of you and to us. We will take the first question. Rama, will you?
Yes, yes. So this is a question which is I think many people will have this in mind. So someone has asked us, I'm trying to shed weight. No success despite exercise and diet. Why does high blood pressure not come to everyone?
Yeah, this question has two parts. One is that here is an individual who is exercising and who is also dieting and is attempting to shed weight and is unsuccessful. Why is it? This is a question which many of us face when we talk to our patients. Now they are sincere in their efforts, but if you look at actually go to the details, you will find one of them is missing. Either the exercise is not up to the expected level, or the food intake, the calorie value of the food that what he is thinking is okay is not all right. So these two aspects should be gone into in detail. Now, to give you one example, now when someone says, I'm exercising for 1 hour a day, but I'm not shedding weight. I ask him, what is the kind of exercise you do? He says, I walk for 1 hour. How do you walk? You walk slowly, or do you have a odometer with you? which will tell you what is the distance you are walking, speed you are walking, and in the end I'll tell him if you walk fast, if you have 5 let us say walk on a treadmill, you keep the speed at 5 kilometers an hour. You know, my friend, what is the calorie that you will be consuming? It is 200 calories. 200 calories is nothing in a person who is eating 3000 calories in a day, in 24 hours, his food intake. So you'll have to design a particular exercise schedule for this gentleman so that he sheds more, I mean, he consumes more calories and he exercises more so that he spends the calories that he's eating. Then the same thing applies to that. You should go into the food that he's eating, and some of us who are experienced in writing out diet charts know what each food item has what calorie. So I make him a list of what he is eating during the day, and invariably I find he is eating around 2,500 to 3,500, which for him it is less because he compares that to what he was eating earlier, which was even more. So these are the details you go into, and generally you will find that you can redesign their lifestyle and food intake. And
No, that's very insightful. I think from
the next question, if you have any comments,
yeah,
go ahead.
yeah,
Then we'll take the next part of that
the
question.
next part about the hypertension. Sure. I think more and more in our society we see weight gain as a significant problem. Most people in their middle ages, you take someone who is 35 and above, there are issues of weight, and often this comes as a cluster. There are people, they are overweight, their blood pressure is also higher. If you check their blood tests, you find that their liver enzymes are elevated because they have fatty liver. Many of them are pre-diabetic, and this has to do with so many different things. But I like to keep three things in mind. One is understand the motivations. Why is someone trying to lose weight? Sometimes people are trying to lose weight because they've been told to lose weight, but it may not necessarily be an internalized agenda which is driven from inside. Second, sometimes people feel guilty. They say they have an image of how their body should look, and it causes them tremendous distress when it doesn't fit the popular imagination or the prescribed imagination. Some other times, there could be some other reason, as Dr. Rao indicated. There could be just a mismatch between your desire to lose weight and an understanding of the process. The amount of calories being consumed will be excessive. The amount of exercise or the type of exercise may either be inadequate or may not be sustainable. And lastly, sometimes people set for themselves really overwhelmingly ambitious goals. For example, I met someone who recently said, "I want to lose 20 kilograms in the next 2 months, and I just want to lose it." That actually sets up a really stressful dynamic. So I have found that when people articulate their own goals, which are congruent with their desires, and which can be broken down into micro goals. Like somebody says, "Look, from tomorrow I will walk for 30 minutes. I will do it this week," and at the end of the week you celebrate it. I said I would walk 30 minutes, and I did it, and you feel good about it. So it's really a process. One condition which I think as doctors we sometimes wonder when someone is doing many things right but not losing weight is whether they might have a thyroid problem. Doc, any comments on that or your experience with that?
I would say, very rapid, as you said, someone wants to lose very rapidly, and if they lose weight like that by following some, very liquid diet or some such thing, rapid loss of weight is dangerous. I would not recommend anyone rapid loss of weight because I have seen a lot of problems with these people who lose weight, it can precipitate a lot of problems.
Sure,
So
sure.
having said that, yes, what did you ask me?
I asked you that sometimes as doctors, we wonder if someone might have a thyroid problem.
Yeah, correct. Yeah. Um, you see, obesity related to thyroid issue is extremely gradual. See, it doesn't overnight come. They don't put on weight like that within, say, 3 months. Or it's very gradual, and there are associated symptoms. Like lethargy, tiredness, listlessness. If she's a woman, I mean, if the patient is a woman, then she will have menstrual irregularities. A host of other issues would be there: hair loss, thick skin, sometimes constipation. So you associate these symptoms and signs and put them all together and order for tests, and you will know that yes, this patient has, in addition, thyroid disorder. Again, sometimes I feel foolish when I tell them to lose weight because sometimes there is a thing called inherited obesity. See, father, mother obese, the son and the daughter also are obese. So there is some genetic factors at play, and these people find it extremely difficult to lose weight. But by following the advice, he or she may lose half a kg a month, whereas the other guy following the same advice might lose 1 kg or 2 kgs a month. So that is the difference. So one should not be put off. And secondly, please remember, all obese people are not unhealthy. You will find many of them overweight, but extremely normal blood pressures. You do their lipid profile, they're perfectly normal. Their sugars are normal, and their main problem is weight. So these are not really very unhealthy people.
Sure.
But they may develop problems related to weight, like osteoarthritis, backaches, and musculoskeletal issues later on in life. So it is better that we advise these people also to lose weight.
Sure. Great. Thank you, Dr. Rao. Let's take the second part of the question. The second part of the question was, I'll just expand the question a little bit more to contextualize. Hypertension or high blood pressure or BP, as very commonly spoken of in practice, is a very common condition that we come across. I think it's a great question this person has asked. Why do some people get high blood pressure and others not get high blood pressure?
Yeah. See, now this platform is really not, designed to discuss this. This is a major issue which will take a lot of time. So briefly, I will tell you, there is something called primary hypertension and another called secondary hypertension. This is maybe my own words. Primary means we still don't know why it happens, but we still know something about it. But the other is we know the cause. Now it may be primarily kidney disease that causes high blood pressure. It may be an obstruction in the arteries that cause high blood pressure. Known arteries in young person, the aorta may be narrowed and then the blood pressure shoots up. So there may be secondary causes which we should always exclude, especially when you see a youngster with high blood pressure. Coming to primary hypertension, that we used to call it the idiopathic hypertension, but it is no longer idiopathic. We still have some cause for this. Now that depends so much on our lifestyle, the way we live, the way we eat. Now consumption of salt, for example. Salt is everywhere. It is used as a preservative. It is used to to make, especially in that, a lot of salt. So salt intake is another reason why over a period of time people develop high blood pressure. So obesity we just discussed is another cause that can cause high blood pressure.
Sure.
So like that, primary cause can be basically lifestyle. There is a inherited hypertension. uh, both mother and father hypertensive, the chances of the children getting hypertension is also high. So it is not, it's a multifactorial illness. So, and also it is insidious. In fact, if someone asks me, all the investigations that you do, tests you do, which is the most cost effective test, I tell them there are only two. One is to check your blood pressure, the other is to check your blood sugar. All other tests, even if you don't do, you don't really miss much. I mean, not really true,
Sure.
but then
Sure.
comparatively, yeah. So it's like this. So you be on your guard, check your blood pressure maybe once a year. If you are already a blood pressure patient, yes, you check it more frequently. Try and do it at home. You don't really have to go to a doctor for this. Similarly, if you are on a medication also, you don't have to go to a doctor every now and then. You see, once you are stabilized, you remain stabilized for a long, long time. But you must monitor your blood pressure every now and then, preferably once in a month or so, because there is an entity called accelerated hypertension. It will be normal for a long time and suddenly it shoots up, and that you should not miss. And that's why frequent blood pressure checks at home. Most of the available electronic devices, blood pressure measuring devices these days are very good, cost effective. So I suggest those of you who are listening, please do buy one if you are a hypertensive. Otherwise, it is may not be worth buying one and keeping it at home.
Right, right. But it so happens that I know very few families where at least someone is not a hypertensive. So sometimes it helps. I think just to summarize two or three points from what Dr. Rao said, I think in day-to-day practice, hypertension is very commonly encountered by us as doctors. The most common association of high blood pressure tends to be with lifestyle, with what we eat, how much we eat, when we eat, what kinds of exercise we engage in, and how we manage our own emotions, stress. And stress is highly prevalent today. The treatment of hypertension primarily is also lifestyle modification, which could be augmented or supported by medications.
Let us not go into the details of
Sure.
treatment because that itself is entirely different. There are so
Sure.
many varieties of medications available and investigations that are to be done.
Sure.
So I don't think we can take it in another session.
Sure. Sounds good. Sounds good. Shall we take the next question?
Go ahead.
So this person has asked, I got a urine test done, and the lab told me it's serious as there is protein in the urine. So, Dr. Rao, how would you respond to this person?
Again, depends really. This is a good advice given by the lab. See, sometimes the labs overdo things. So this one lab which has given the right advice to this patient so that that patient should go to a doctor. In a routine examination, to finding albumin plus in an individual is not abnormal. I mean, not unusual, let us say, but it is abnormal. Microscopic albuminuria. Albumin is the protein. He said his protein, but let's say albumin loss. Albumin is the one which has very low molecular weight. So it escapes from the glomerulus lining of the nephron quite easily. So that means there has been some minor damage to the collecting unit and the filtering unit of the kidney. But it can happen in several conditions. Even in a very healthy individual who, if it shows less than a certain, I don't get the figure, I think it's 150 micrograms milligrams or something in 24 hours. If it is less than that, we don't consider it serious, but still we advise that person to keep a watch on the protein loss. It can happen in athletes
Right, absolutely.
in
Correct.
people who exercise a lot,
Hmm.
fever states.
Hmm.
So this can happen, but that is not serious. But it becomes serious when this protein loss is more.
Hmm.
That means there is definitely kidney damage.
Hmm. Hmm.
The- Assessing kidney damage becomes a very important aspect of finding out the type of kidney damage.
Sure. Sure.
So we do some basic investigations. The urine analysis is one, blood tests are the other, and we do a renal ultrasound to see if there is any scarring or any problem in the collecting system. And quite a few of these, if detected early, we can protect the kidneys by the available medications these days.
Sure. Sure.
So we also do the electrolytes to see if they're all right or not and assess overall whether this person has very mild kidney disease or advanced kidney disease. Based on these tests, we can categorize the illness and sometimes if they need a kidney biopsy to exactly know how there are some classification of kidney disease, we can arrive at the diagnosis and treat. So, presence of albumin in the urine should not be taken lightly.
Sure. Sure. Just to add to that, I think there are two common conditions which we commonly come across, which are associated with the protein in the urine. One is high blood pressure, the other is diabetes. So, assessing how well someone's sugar is controlled or how well their blood pressure is controlled will become important.
There again, and you are I'm glad you brought it out. In fact, today, if someone in the middle age
Hmm.
who comes and says, "I have protein in the urine," what to do? We also look at whether he has got sugar in the urine also. And if there is no sugar in the urine, also you must do and see whether that is an episodic one, that there is no sugar, or he really has blood pressure, high blood sugar, but on that particular moment it may not have come into the urine. So we have to do blood test also for such people. So excluding diabetes is a very important thing. And today, so many being diabetics, protecting their kidney becomes extremely important. So that means diabetes control.
I think that's a very, very important message to take home. Thanks, Dr. Now we have a question related to the respiratory system. So one of our viewers has asked, I was watching TV. The doctor there advised all who have a cough for more than 15 days to do a chest X-ray and check the sputum test for TB. You have advised a zero flow inhaler for my cough. Hope I don't have TB. Doc, maybe this is actually one of your own patients.
You see, I think this gentleman must have been watching the TV doctor. Recently, there was a
Oh, Dr. Subramaniam spoke.
World TV Day.
Okay, okay, okay.
World TV Day.
Okay.
And yes, you see now, broadly speaking, we have to. TB is a widely prevalent headache in this country. You see, because it's a headache because it is difficult to spot early, it spreads in the community, and the symptoms are mild enough not to become so obvious to the patient to go to the doctor early. And there are various reasons why TB is still very prevalent in our country. And that's not going into the details of why and what. We are trying our best to try and control it and, if possible, eradicate this disease. So, keeping that in mind, the TB Control Authority of this country has brought in some guidelines. These guidelines are anyone who is coughing more than 2 weeks, do a chest X-ray for them. It's a guideline. Similarly, do a sputum study. Between the two, if he is bringing out sputum, a phlegm, when he coughs, is an easier way and less harmful way of testing whether there is TB or not. I would prefer that to be done first. If that is negative, if still coughing, then inhaler. If these two are negative, it is unlikely that the man has tuberculosis. This is how we screen the population which complains of cough and phlegm. There are other things, like fever. Now, TB doesn't come just by fever and cough, but these are screening methods that the government of India has thought fit to implement. Now, coming to the that question of seroflow, see, doctors, we know our patients. Now, if there is a patient who has cough and a wheeze, who has been coming to me year after year during seasons, and I examine him and I found cooing I said, like a cat mewing in his chest, I know that this is not TB and he has no fever and seasonal. His respiratory distress is not due to TB, it is due to bronchospasm induced by asthma or a kind of an allergic cough. So treatment is by inhaled steroids with bronchodilators. Seroflow is one of them. So please don't confuse one with the other.
Sure. I mean, these are the types of questions which make our life interesting. Of course, they challenge us as doctors because while we can be confident, as doctors, sometimes we can't be 100% sure. But definitely, I think what Dr.
Yeah.
Rao said.
There is what he said. Supposing there is a patient who is nicely taking Seroflow and getting better, and he gets TB. So the doctor should always be on watch.
On the watch.
For the unusual. So I would not take it for granted. I would still ask him, look here, your cough is worse, you bring out dirty phlegm. You better go and just take an X-ray of the chest or do your sputum study. Despite knowing him that he is a seasonal asthmatic, I would still exclude TB. I mean,
one good news though, which I want to emphasize, is TB is eminently treatable. You know,
yeah.
It's important to know that because I still meet people where when they get diagnosed with tuberculosis, it is so anxiety provoking for people go into depression. People feel
the societal issue. You see, we doctors have this responsibility to tell patients. Similarly, with vitiligo, I don't like that word leukoderma.
Okay.
See, vitiligo, so what? Vitiligo, it's an innocent disease. Why do you make a big issue of it? Sometimes society can be blind, and we as doctors should also be teachers.
I think doctor comes from the word teacher. Dossier means to teach, actually. So anyway, so TB is very. So thank you for this great question, actually, and it's very timely as well because the 24th of March worldwide is celebrated as world, not celebrated, but we think about TB. It's called World Tuberculosis Day. So thank you for that question. Doc, one of the questions we've had is this person has asked, why am I constipated some days and have loose motions on other days? This person also tells us that his or her stool test and endoscopy test are normal.
Time and again, you get these issues. They would have gone directly to the hospital. That's why I keep telling everyone, media written about it, that patients, people, should go to their primary care physician first. Not go directly to the hospital. The hospitals are not killers, but they have a protocol to follow. See, there is a protocol to follow. They don't want to miss anything. Anyone who is going like this to the hospital will be subjected to some basic tests. Whereas if you go to your own doctor, he knows your whole history, you've been going to him. He may also advise, that's a different issue, but he may often not advise you to do some tests. Here is a case already been done. So, what do you think?
Again, I think so. See, a combination like this where someone is having loose motion certain days and constipation some days, depending on age and what else they are experiencing, can either be something very concerning or something which could be related to anxiety, could be irritable bowel syndrome, etc. So really, I mean, it goes back to
the experience.
Yes.
Our experience is not always great. I'm telling you. a stupid experience over and over again, the same nonsense you do. That is not good experience. But going by what I have seen in such patients, it is due to diet.
Diet.
Yeah. You see, if you eat lots of vegetables, roughage, fruit, and you are a vegetarian, you move your bowels more frequently. There are, in our country, there are most meat eaters, you can call them also vegetarians because they don't eat meat every morning, afternoon, night, except in some communities that I know. So, what's likely to happen in a case like this? I would ask these questions. Do you get constipated during your weekends? If the answer is yes, I'll ask him, do you eat a meal with meat on that day? If he says yes, you have the answer. If you high protein meal with low residue and an ice cream cone over that, which completely gets absorbed, he will be constipated the next day. So 5 days in a week he is not constipated. 2 days in a week he is constipated. Most common cause. The other causes is what we should exclude irritable bowel syndrome. He has put a scope up. He has not found tumor, no cancer growth there. So it could be IBS. IBS is again, we, you can say idiopathic. We still don't know. It is probably related to microbiome. We have been eating antibiotics left, right, and center, which goes and destroys the friendly germs which are there on our body, inside our body, everywhere, and we go and eradicate them and pay the price.
That's right. If you recall, we were discussing once that the number of cells we have in our body, which are human cells, we have 100 times more bacterial cells living in our
Inside
body. Yeah,
inside and
Yeah.
on our skin.
on our skin.
So, too fastidious, um, you know, washing your body 4 times a day is not really very good. In fact, quite a few of skin conditions, for example, armpit abscesses and furuncles, is due to too much of washing and spraying germicides here and there. You see the advertisement, you get carried away, and every other advertisement in the TV, I see this one only. They're spraying each other to attract. And the girl is trying to attract the man, and the man is trying to attract the woman. I mean, I personally am against such ads, but people get carried away, and every other day probably you see an armpit abscess coming and seeing you.
um, Agree with you, and I think we also see in women vaginal douching, where they clean inside the vagina and put themselves at risk of vaginal yeast infections and things like that. I think that's a great point. The next question we have is um, uh, yes. So this is asked by a woman who's asked, I stopped menses 2 years back. Lately, I'm noticing mild bleeding which stops. What should I do?
Yeah. This is this is a very good question actually, because post menopausal bleeding is always serious. Now the question is, when is it serious? When do you know I have stopped periods?
Hmm.
Experience shows that it can stop abruptly, or it can take 6 months on and off. But if this is going on and off, a woman who is regularly having her menses every month or every 20 days or 30 days or so, and suddenly around the age of 45, 50, it becomes very irregular, once in 2 months, once in 3 months, but doesn't stop. I would advise her to get a pelvic ultrasound done, just to make sure her endometrium is thin.
Hmm. Hmm.
If the endometrium is thick and she is irregularly menstruating, she needs probably endometrial biopsy.
Hmm. Hmm.
In this lady's case, it's almost what she said 2 years.
It's been 2 years since her last.
It's all the more reason that you should do this test.
Right.
And a good sonologist will even tell you the thickness of the endometrium. Endometrium is the lining of inside the uterus, which sheds every year, every month, cyclically in women who are premenopausal.
True.
Postmenopausal, it can stop abruptly, or it can take some time, maybe 3 months, 6 months, or even a year before it completely stops. And if the endometrium is thin, maybe 4 millimeters or 2 millimeters or 5 millimeters, one need not have to worry, but keep a watch.
Sure.
But if it is 8 millimeters, 10 millimeters in a woman, 2 years from the time she stopped, it is mandatory that she must see a good gynecologist.
Sure. I think thank you for this question because many others will also get this information. But definitely, in someone who has stopped having periods, that is post-menopausal, the onset of any bleeding has to be taken very seriously. There's one more condition which in India, as in other parts of the world, is a major killer, which is cervical cancer, cancer of the cervix of the uterus. Doc,
Yeah, the difference is cervical cancer can come at any age. It can come early, but more common in the later. And in cervical cancer, there is no need to differentiate between the two. Any woman who has vaginal discharge post menopause needs investigation. But cervical cancer has more white mixed with red, and it is a continuous flow sort of.
Sure.
It doesn't come and go.
So
You can differentiate clinically like that.
So your point is, regardless if someone is having blood bleeding after they've achieved menopause, this is to be taken seriously, and they should go see their family doctor or they should see a gynecologist.
When you are talking about cervical cancer, the audience must now understand, especially girls who are sitting there, that it's a preventable cancer, and vaccine is available against cervical cancer now, and it is advisable all young girls take it.
Right. And especially if the vaccine is taken before someone becomes sexually active, then it protects significantly. So do talk to your family doctor. Doc, we have 20 more minutes, and there are several questions that people have asked. I'm just going to pick a few of them for us to. I wanted to ask you actually. You were telling me something very interesting before I pick the next question. Now, over the last 50 years of your practice, do you notice that thyroid problems have become more common?
Yes. Uh, if you ask me the reason, are we detecting it more?
You think, are we detecting it? Okay.
To some extent,
Okay.
yeah.
Okay.
Secondly, it is again an autoimmune disease. Both hyper and hypo are supposed to be having an autoimmune etiology. Autoimmune means the body produces antibodies against your own cells and kills them. So, is it that? Or, as one of the discussions that took place, and I'm not able to tell you where I read it, iodization of salt. Universal availability of iodized salt. Is it the cause? You see, it's like this. Supposing now excessive intake of sugar, too much of calories is one way of leading to diabetes, along with lifestyle sedentary habits. Similarly, if you provide iodine to the body, to the thyroid gland, and thyroid cells don't have to work to absorb it, then they'll stop because there is so much. So there is a fatigue resulting in hypothyroidism. A theory which may explain why there is increased incidence of thyroid disorders.
Hmm. 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 Hmm.
One is increased detection. We are very
Hmm.
now, along with obesity,
Hmm.
very common to ask for
Thyroid,
thyroid
yes,
hormone
yes.
study, thyroid stimulating hormone,
Hmm.
and also active thyroid component. More sensitive of the two tests is the thyroid stimulating hormone test.
Hmm.
So that these are the reasons I can think of.
Right, right. No, and certainly quite interesting. Um, we have someone who's asking, and I'm imagining this is perhaps an older individual. He or she says, I have developed a fear of falling. Fear of falling can keep me from going about normal activities. And as a result, I may have become frailer, which actually increases my risk of falling again. Please help.
You see, frail elderly, they are a different risk group altogether. Why one becomes frail? As we grow older, we lose our body mass, especially the muscle mass,
Hmm. Hmm.
which is which is a normal aging process. So to prevent it, we exercise those muscles. Now here is a lady who is afraid of even walking for the fear of falling. So she is at higher risk of becoming frail.
Hmm.
Now, how these are people generally who live on their own
Hmm.
or with their husband,
Hmm.
who is also elderly,
Hmm.
who may not be of great help to this
Hmm.
lady.
Hmm.
Children being away, many of them will not be living with this couple.
Hmm.
So she is on her own.
Hmm.
If there is a help in the house, it is your duty as a family physician to advise them to go with this lady. Make her stand first. Use an aid
Hmm.
depending on her seriousness of her condition, either a walking stick or a walker,
Hmm.
and walk with her.
Hmm. Hmm. Hmm.
Not just tell her to go. You walk with her. Come back and sit. Do that 5 times in the morning, 5 times in the afternoon, 5 times in the evening. Keep increasing till she develops confidence
Hmm.
that she can do it herself.
Sure.
See, developing confidence is the most important aspect of many activities in the elderly.
Hmm. Hmm.
See, many elderly avoid going to crowded places
Hmm. Hmm.
because they feel out of place. Many of them don't know how to use a digital platform.
Hmm.
So this is one of those. Inside the house herself, she
Hmm.
feels that if I fall, who is there to manage me?
Sure. Sure.
That
Absolutely.
fear
Hmm.
is the
Very
key. So if there is help to do
Hmm.
it,
Hmm.
otherwise as a doctor,
Hmm.
you can make some house calls,
Hmm. Hmm.
maybe once in 2 weeks. Spend
Hmm.
some time with that lady, maybe
Hmm.
half an hour or so.
Hmm.
Make her walk up and down. You
Hmm.
have now home care teams.
Hmm. Hmm.
You yourself associated with the Aveksha.
Hmm.
So these people go spend time with the patients,
Hmm. Hmm.
and that is how the confidence builds up.
Definitely, definitely. I think just to add two more points, sometimes there could be the reason someone might be at risk of falling or feeling that way may sometimes be issues with the eyes,
Correct. Yeah.
or sometimes even just
Yeah.
wax impaction, just wax having collected in the ear. So definitely, physical examination helps meeting that person and seeing what that person does. And unfortunately, Dr. Rao alluded to this. What happens is whatever we don't use often, we start losing those skills.
Ability, yeah.
So definitely encouraging someone to continue walking or doing activities with support in a safe manner, as Dr. Rao indicated, I think is critical. Um,
That's a huge problem.
it's a huge problem. It is a huge
Growing population of the older age group
problem.
with no real social security in place. There is no home nursing available.
True.
Home nursing from the state I'm
Hmm.
talking about.
Yeah.
So we are very backward that way.
Hmm. Hmm.
Our primary care infrastructure in this country is doddering.
Hmm.
I mean, it's a very sad state of affairs.
Hmm.
I'm digressing from
No,
the
no, you're not
discussion,
digressing. It is.
but the government moving away from healthcare and
Mm,
education has done a great deal of harm to this country.
mm, mm, mm. I'm sure that's a rich and important discussion to have. But Dr. Rao, I mean, see, this is a very important problem and it's a growing problem. India, our population in India, whatever aging related problems we are seeing today, we will be seeing many fold
Yes.
a larger burden of these aging related problems over the next coming decades. So this is something we need to pay attention. Um, I will end our session today with maybe one or maximum two questions. But there's someone who thinks like you, and I did not make this up. Look at this question. So this question is: healthcare is now defined as consumer care rather than a service. Has the health system slipped? Do we have the right account for the healthcare services?
Yeah.
And I don't mind if we discuss this a little
This
bit.
I'm glad. There are individuals like this who are thinking in these terms.
Hmm.
I agree with him. We are slipping. You see, private healthcare is there really with a motive of profit. Secondarily, of course, they have to cure, otherwise, they will not be in business. Between the two, there is a big gap in many healthcare facilities privately run. Without going into details, I would just tell you this much. A publicly held or run healthcare system efficiently, and very important to say efficiently, properly, is far superior to privately run healthcare, given the large need for a large section of population. If you are only thinking 10% of our population who need top class medical attention, then I am not the party to discuss it. See, 10% of the population getting excellent healthcare does not mean anything to me. What about the rest 90%? We are seeing a huge problem today in our country. Now, the question that he's asked,
Hmm. Hmm.
yes, we are slipping. The answer is not privatization of healthcare. Private funds, if as philanthropy minded people can run public institutions in a publicly spirited way. Yes, that is possible. Private money going into public service is an excellent model, but that doesn't happen.
I think even the question of does the 10% get the best care is, I think, open to question because sometimes over excessive care may not necessarily be appropriate care.
I agree. You see, in our country right now, there is a thing called medical tourism. We are providing first class care to the persons who can afford this kind of treatment. And sometimes, when I go to these star hospitals and the private rooms, they are better than seven-star hotels. But the service rendered there is far cheaper than what they would get it in Europe or in the United States. So the tourists, who are ill tourists, I would say, they come to get their attention done or treatment done to our hospitals here. But middle class Indian or a poor Indian cannot go there.
And I think one of the things I definitely notice and think about is the loss of the doctor patient relationship. Now you've been a family doctor for 5 decades. One of the things, and you've written extensively about your experiences with people. I think what stands out is your relationship with patients. People know you for decades. In fact, I saw a patient of yours who was referred to me by you, and he brought yesterday notes from 1999. You know, So that's 22 years. I've also seen a patient of yours who once brought notes from 1974. So, so I think that loss, that I think it's really important to have that family doctor with whom the family has a relationship and who is able to serve as a doctor of first contact, serve as somebody who knows, understands the family, the context, the living conditions of the family.
See, there is a impression amongst the people that all public hospitals run by government are no good. I beg to disagree. There are hospitals here in Bangalore, like Nimans, for example, Jayadeva, even Bowring Hospital. The service that they render is so far, in many ways superior. And they don't advertise like the private hospitals. So somebody removes a 20 kg tumor from somebody's abdomen, becomes big news in the newspapers. Whereas a poor surgeon, I would say poor, surgeon in government service would have removed a 30 kg tumor, but he won't advertise. He won't call the press to come and take a photograph of his holding that tumor. So I'm just telling you.
Sure, sure.
Even today, despite my criticism of primary healthcare being poor, we managed to fight the COVID epidemic. Imagine how well, much better way we would have done had our primary care would have been far better than what it is now.
um, Dr. Rao, myself, and a few others, we are involved in a fellowship and leadership program for primary healthcare doctors. Some of the stories we hear are astonishing. Like one of the doctors, Dr. Manjula, she, during COVID and before that, she's a primary healthcare physician, manages thousands of patients. And there was a time when salaries were not being paid, but people continue to work. So there is no lack of. I think it is
only thing is we must give them status.
We have to
and
acknowledge.
That is the society must acknowledge these people.
Right.
And they are the real true soldiers. Like the infantry. Infantry is the most important arm of the army. These primary care physicians are infantry of the healthcare system of the country.
Absolutely. We've come to the end of our session. Supriya, if you think there is an audience question or two, maybe we can take it live. It's 6:53, so we have sorry 4:53, so we have about 7 minutes. Supriya, perhaps someone wants to ask a question.
Yes, actually, Doctor, whatever question we had, we have posted here right now. I hope so. We have answered everything and covered all the audience question. So, if we are okay, so if you have anything to say to the audience, Doctor, for the any advices or something.
Yeah, I think we said it. If you are ill, if you can, please go to your own family doctor. If you don't have one, please try and find one. He will act as a kind of your watchdog and a gatekeeper and prevent you from going into problems. And he also has a network of his own friends who specialize or subspecialize, and he knows who is who, and he will get you the best treatment available, even if you need when you need one. And let me tell you, my friends, that 90% of illnesses occur in the community. And community-based doctors like primary care physicians are the ones who treat this. It's only 5 or 10% who need hospitalization. And who go there when your primary care physician decides this, who is amongst this 10%?
Great.
Yeah. Yeah.
One last parting message for today is, friends, as we've seen, we have seen a rise in COVID cases recently. There needs to be a surge in many of our cities. So please do take precautions. Follow the mantra of social distancing, wearing a mask. The Dr. Rao and I will probably get criticized for doing this without our masks, but we do wear our masks wherever we go.
We removed our masks because it become more
audible, but we follow all precautions. Vaccines have become the vaccine has become available. Anyone above the age of 45 can now go and take the vaccine. There are two vaccines available in India: Covishield and Covaxin. Which one you take doesn't really matter. And please wash your hands, wear masks, follow social distancing, and
safe.
be safe. Be safe. Thank you very much.
I think that's a good learning we have got from you, Doctor, today. Sure, the audience is glad to have heard that. Thank you, Doctor B.C. Rao and Doctor Ramakrishna Prasad, for taking your time from your busy schedule and doing this wonderful session for us. So, dear viewers, stay tuned for the other session coming on next Saturday on the same time. Till then, please follow us on Instagram, Facebook, LinkedIn, Twitter. So, for also more information on Project Step 1, visit www.projectstep1.org. Thank you so much, Doctor, for this wonderful session for today.
Thank you.
Okay. Thank you.
Thank
Thank you.